Hi, this is another episode of Life with Hospice. Today, I would like to talk about who would benefit from hospice services. This question is really easy to answer because it all has to do with what are the goals of care. There are two main goals with two different types of patients that would determine whether hospice would be good for them. First, I'm going to talk about the type of patient who hospice would not be a benefit. First of all, it would be a patient who has a terminal illness, but they are not done fighting that terminal illness. Someone who would continue to want chemotherapy and radiation to try to get rid of the terminal illness. Someone who continually wants to go back to the hospital for different reasons. Somebody who would continue to dial 911 when there's something going on with the patient at home instead of relying on the hospice team to come and help with that symptom. That is something that we will see in hospice is when you are on hospice care, you no longer need to call ambulances to take you to the hospital for symptom management. It could all be done in the home with the hospice nurse. But there are times when families immediately call 911. That's always what they've been used to. And instead of calling hospice, who would come and take care of that patient and help with that symptom management. So if a family is the type of family that would constantly want to go to the ER for everything, they are not a good candidate for hospice. If it's a family who could learn to accept the assistance of a hospice instead of calling 911, then that could be something that could happen eventually. But if it's somebody who immediately just wants to go back into the hospital, then that's not the type of person who would benefit from hospice services, because Medicare will not pay for hospice services and hospital services. You either have to have one or the other. So if a family continually wants to call 911 to have that patient transported to the hospital, then that family, when they get there and want services from the hospital, they have to actually revocate out of hospice because both cannot be paid at the same time. So they either have to have hospice services or they have to have hospital services. So the only time that a patient would be in the hospital and they would still be on hospice would be if they were a general inpatient, like we're trying to manage symptoms, or if they were in there for respite care. During those two situations, though, they're still under hospice care and they're not seeking aggressive treatment. So if someone continually wants aggressive treatment, they are not a good candidate for hospice services. Some people may just not be ready for hospice, and that's okay. That's okay if somebody continually wants to have the treatments, and it's whatever your goals of care are. Now, if somebody is done fighting the disease, they feel like they're at the end where treatment is no longer going to help them and they just want to be done with that and they want to move to comfort care, then that's where hospice services definitely would benefit somebody. Some hospice patients can still get radiation treatments, but it's all for palliative reasons. It's not for curative reasons, and that's kind of the difference. Palliative care is to help with pain management. I had a particular individual who had a leg tumor, and so that person was getting radiation therapy not to cure the tumors, but to try to shrink them a little bit to give them some pain relief, because it was just very difficult getting this person's pain under control. So in that instance, it's okay to stay on hospice and still get the radiation treatment. But if you're constantly trying to get radiation, chemo to try to cure the cancer, then that's not where hospice comes into play. If a patient has a terminal illness and they want to allow a natural death, then they're most likely a good candidate for hospice services. Hospice is all about comfort, helping somebody get to the end of their life as pain-free and anxiety-free and just comfortable as possible till the end of their life. That's what hospice is about. So if that is for you, then hospice services most likely will be for you. I wanted to talk a little bit, and I think that I talked about this a little bit in an earlier video. I just want to give you a little bit of information on if you have a terminal illness, the difference between being on hospice and not being on hospice is. If you are not on hospice and you have a terminal illness, you're having pain issues, and you're in the hospital, chances are pain control that you need is sometimes an issue. Not always. I'm sure it's not always an issue, but it's sometimes an issue, because the medications that are used in hospice, the amount that is used is sometimes not used when you're not in hospice, because some non-hospice providers are nervous about giving too much medication. In hospice, we do what we need to do to control your pain. Near the end of life, if somebody has metastasis everywhere, the pain can be extremely bad. We're not going to overdose anybody on medication, but we're also not going to barely give any because we're afraid of respiratory depression. So usually somebody who is not in hospice, and especially if they're in the hospital, they're not going to get the pain control that they need some of the time. If they're having issues with swallowing, which does happen a lot at the end of life, and if you're in the hospital setting, they'll make you NPO, which means you're not allowed to eat, because they're afraid that you're going to aspirate into your lungs. Well, when you're in hospice care, you run the show. If you want ice cream, you get ice cream. If you want a cheeseburger, you have a cheeseburger. You get what you want at the end of life when you're on hospice, even if you're in the hospital, as long as you are under hospice care. Our philosophy is you are at the end of your life. You deserve to have whatever you want. And even if it would, cause some aspiration, we don't want you to aspirate, and we'll do whatever we can to try to minimize aspiration as much as we can, like putting the head of the bed up, making sure that all the precautions are put in place to keep you from aspirating, but we're not going to tell you, no, you cannot eat. We're just not going to do that. If a patient wants, in fact, I have a situation, we had a lady in a nursing home, 102 years old, and she wanted beer. And normally patients in that nursing home were not allowed to have beer. They were not allowed to have alcohol. Whereas this lady, we brought her beer and she got beer because she was on hospice and she deserved to have what she wanted. So she got to run the show. So there is a difference with being on hospice and not being on hospice when you are a terminally ill patient. So I just wanted you to know that information, just to kind of help make that decision. So this video today is going to be a little bit on the shorter side. So I hope that it's given you some information. If you have any questions, you can email me at monique@lifewithhospice.com with any questions that you may have or any other information that you may need about this subject. So we'll go for now, but next video will be CPR versus DNR and the difference between the two. So we'll talk to you later. Bye-bye now.